Did you know that a single vitamin can decide whether you get pregnant or not? Yes, that is as amazing as it sounds, but that is a fact. Hi, I'm Dr. Priya, and today I'm going to share the easiest and most powerful tip if you're trying to conceive. This vitamin supports healthy eggs, helps ovulation, and even protects your future baby's brain and spine from day one. And that is folic acid. Now, why folic acid matters? Folic acid is a type of vitamin B9 that helps your cells make DNA, the blueprint of life. It is so important that folic acid can increase the risk of miscarriage and birth defects as well as decrease your chances of conception if you are deficient. It also supports healthy sperms in men. Now, I want to share some. Many of my patients who felt that they are infertile and they have been trying to conceive for years and years. You won't believe, just within 3 to 6 months of starting folic acid therapy, they conceived. Most of them conceived. If there is no other major problem, folic acid will definitely work for the good for your conception journey. Yes, this is not a hoax. This is a practical thing that I'm sharing with you. 80% of women don't get enough folic acid from food alone, and by the time they find out that they are pregnant, it is already late. That deficiency has already affected their baby. Now, how much folic acid you should take? Well, the ideal dose that is recommended is 400 to 800 microgram of folic acid every day, starting at least 3 months before you actually try to conceive. This is because your baby's brain and spinal cord start developing much before you know that you're pregnant. And not only that, it supports your fertility journey by supporting your egg quality as well as the endometrial lining that actually is going to hold the pregnancy. But folic acid doesn't work alone. It needs certain other vitamins and nutrients for better absorption, such as B12, zinc, and vitamin C. So you must include these along with folic acid if you want the folic acid to work properly. Look for a prenatal vitamin which has a combination, but I prefer giving separate supplements to my patients along with folic acid. Skipping this one vitamin can make your pregnancy journey 10 times harder. So you can also get it from different food sources or natural sources, that is the sources of folate like green leafy vegetables, citrus fruits, beans, nuts and seeds. This has been mentioned by Ayurveda many years ago. Ayurvedic foods naturally rich in folate include moringa leaves, amaranth leaves, sesame seeds and fenugreek leaves or methi leaves. Modern science confirms that these are naturally high in folate and deeply nourishing to the reproductive system, just as Ayurveda described them as supporting the Artava Dhatu in women and Shukra Dhatu in men. Even your IVF success rate drops a lot if your folate levels are low. So remember, start taking 400 to 800 micrograms of folic acid every day with a diet rich in greens and these Ayurvedic power foods that I mentioned. Moringa leaves, amaranth leaves, sesame seeds, and methi leaves. Also, there is one important factor or aspect. Folic acid will not work if you are really stressed and unhappy in life. So please remember, the first step for pregnancy or conception is your happiness, is your peace of mind. Only then whatever you eat, whatever supplements you take are actually going to work for your body, in your body, for your favor, the way you want it. If you found this useful, share it with any woman that you know is trying to conceive. It might help her. And subscribe to my channel so that you can get more such tips and information about your health and body. Thank you.